Hi, everybody. My name is Jeffrey, and today I will be presenting on cervical cages. Cervical cages are subject to four modes of loading: compression, axial rotation, lateral bending, and flexion or extension. Axial rotation occurs when we look left and right, such as when we cross the street. Lateral bending occurs when we tilt our head side to side, such as when we hold a phone between our shoulder and ear. Flexion occurs when we nod or tilt our head down. Extension occurs when we tilt our head back. When it comes to failure modes, the most common are screw loosening, fatigue of screw or cage, and wear of fixation surfaces. However, not all spinal cages have screws. The typical stress concentration for each loading type besides compression is shown in the FEA diagram here. The first row of FEA images is of a cervical vertebrae undergoing expected loads. The second row is of a cervical cage undergoing the same loads. The stress concentrations for both are in similar regions, near the perimeter of the vertebra or cage. These cages also suffer from a number of clinical challenges and failures that can occur with cervical cage implants. The most common issues include cage subsidence and migration, where subsidence is the sinking of the cage made of a high elastic modulus material into the spine with a lower elastic modulus. This subsidence occurs as a result of micromotions between the implant and spine and can result in the loss of disc height. This further exacerbates issues in the body by inducing adjacent disc degeneration and increasing the inward or outward curvature of the cervical spine. Cervical cage implant systems that use plates can also cause esophageal injuries due to soft tissue swelling around the plate area. Overall, these cervical cages are always trying to improve fusion rates as well as maintain a patient's natural range of neck motion. Historically, there have been two FDA recalls since 2002, which is not a lot compared to the 186 injuries or malfunctions so far in 2020. Additionally, because cervical cages are used in spinal fusion surgery, litigation around cervical cages typically involves people suing over failed spinal fusions. One of the biggest cases is Medtronic's Infuse device, which has had over 10,000 people sued because of patient injuries. For areas of improvement, substance rates can be decreased if there are improved fixation methods. One of the design features of spinal cages is their rigidity, which is good for stability but bad for shock absorption. This can lead to adjacent disc degeneration due to poor distribution of dynamic loads. Another disadvantage of the traditional spinal cage design is its hampering of motions in the axial rotation plane. Thanks for listening.